Okay, do we have everyone here? Hey, Counselor. Let's see. We have all our speakers here. Tanya Vasolo, Fox. Okay. Where's Broll? All right, Broll's here. Just checking. Okay, good morning, everyone. First of all, just sound check. Can everyone hear us like this? Okay, the sound. Okay. Come up, Rep, if you want to come up. I see you. And any counselors who want to join too. Thank you so much for being here. And Councillor Flaherty too, if he wants to come up. Look, we're in a park that belongs to the people of Boston, and that we have been working extremely hard to try to make sure we are making improvements every day. I'm standing here with a group of the most committed and dedicated individuals who have been working day in and day out to ensure that our city continues to make progress in what can feel like an intractable situation that we are facing in cities across the country. Some of the leaders who are here today and who you'll hear from shortly are Director Tanya Del Rio, Director of our Coordinated Response Team, Executive Director Dr. Basola Ojukutu, who runs the Boston Public Health Commission, our Boston Police Commissioner, Michael Cox, Sheila Dillon, our Chief of the Office of Housing, Superintendent of Street Operations, Mike Broll, and Commissioner of Parks and Recreation, Ryan Woods. We're also joined by our partner who is basically a city, think of her as a city staff leader almost. She's doing so much in partnership and advocating for the community and the businesses, Executive Director of the Newmarket Business Improvement District, Sue Sullivan. We are here at Clifford Park, a space that children and families in Roxbury and across Boston deserve to be able to use to its fullest and to enjoy. As a city, we have a responsibility to care for those living with substance use disorders and mental health challenges, to connect them to services that they need and deserve. And at the same time, we have a responsibility to address the impacts that these challenges have on our communities, our local businesses, our residents, our kids. We must mitigate the public health risks to families, young people, and residents of all ages who deserve parks, playgrounds, streets, and sidewalks that are safe and clean in every part of Boston. So today, we're going to provide some updates on steps that this team has been working hard to deliver on all of those fronts, and to share a little bit of my thoughts about now that we are here, what we have learned over the last 10 months and what we need moving forward from the state and from other partners in addition. Yesterday morning, thanks to members of our Transportation Department, Department of Public Works, Police Department, Public Health Commission, Office of Housing, our Coordinated Response Team, and Newmarket BID, we helped shift residents from Southampton Street to Atkinson Street to improve public safety, to get off a busier road. For anyone who has driven through that area or walked nearby, it's been clear for some time now how dangerous this is for both the drivers and pedestrians alike to have groups of people congregating in or near the street. And we saw yesterday the same type of work that happened yesterday is the work that has been happening for months, multiple times a week, of ensuring deep cleaning and basic sanitation to mitigate some of the impacts of what we are experiencing. It's hard to stand here and talk to you all about how much progress that we've made when I know it still feels like the city is bearing so much and so visibly shaken and affected by the depth of substance use disorder and mental health and homelessness that we are still struggling to meet the demand to serve. I do want to remind everyone of the context and share a little bit about what we have learned along those lines. So as we all know, there used to be a whole row of fortified, deeply entrenched, long-standing encampments that pose significant public health and safety risks, both to those living in those tents and in the surrounding community. And over the last few months, really starting with a housing surge that resulted in a removal of encampments in January, there has been an ongoing effort every single day to prevent that type of deeply fortified rows of entrenched encampments from reemerging in the city, while centering the people at the heart of this crisis and the services that are necessary. Earlier this month, we worked in partnership with our community partners, to open up 2 new low-threshold Boston Public Health Commission daytime centers. These are spaces where unhoused residents can escape the cold, get hot meals, and work with our teams to explore housing and other service options during the day. They're also helping decentralize the services that we're providing in the area, because we know that while homelessness, mental health, and substance use aren't isolated to any corner of the city, many individuals end up concentrating right in this area, seeking treatment, shelter, and other services. The addition of these centers adds to work that happened over the summer, where in August, the city launched the Mass and CASS hub table, which facilitates interagency collaboration and sharing information about our ongoing efforts day by day, every single morning. The level of detail about specific locations, individuals who need services, outreach that is planned out for that single day is coordinated across all of our agencies in a way that we had not seen before. Our public works teams have added new streetlights and have been working on street cleanings multiple times per week, 19 different cleanings every single week in the area. I've ridden along and seen the care and the diligence and attention to detail of each one of our team members in doing this, knowing which streets, which locations need a little bit of extra care just to make sure that we can help mitigate these impacts. Our teams have collected more than 200,000 syringes since January, and that's not even counting what community members have been doing it in terms of coordinated efforts. And we've seen the number of 311 service requests for needle pickups decrease because of the routine cleanings that are now scheduled for areas just like here in Clifford Park. So far, we have managed to prevent the reestablishment of a permanent fortified encampment at Mass Ave and Melnea CASS Boulevard. And more importantly, since January, we have connected nearly 400 people to low-threshold housing and secured permanent housing for 65 people. I'm so proud that all our city departments have done in collaboration with with the New Market bid and our communities to prioritize creating safe environments for our residents to access critical services. While these improvements and investments are worth celebrating and highlighting, I would just ask that we could share some information with the public and get these details out to have a transparency about what we're doing. And there's a lot of noise, but I want to be able to share some of the information that we have been working on. As we prepare for the colder weather, respectfully, sir, I will engage with you after this, but we need to get through this information so that everyone in the community can understand we've been working on. Thank you so much for being here, though. I respect and appreciate your passion. As we prepare for the colder weather, we will be helping our shelter partners expand capacity because we know the winter is coming. And we're doubling down on recruiting more BPHC case managers to reduce bottlenecks in residents receiving the critical care that they need. We have also seen the limits of our capacity as a city. We know that in this area, we are receiving people from across New England. In the months ahead, we're looking forward to working with our partners at the state and regional level. All right, you all, if we're going to do it like this, we're going to pull this down and talk to folks on the side. So I'm going to pause to see if we can get some time and quiet to share information.
Respect our First Amendment rights. Respect our First Amendment rights. Respect our First Amendment rights.
Okay. Domingos, I'm going to engage with you afterwards, okay?
Don't come here and sell us the BS. You still haven't visited the kid that got pregnant a week ago.
We have been working for 10 months to ensure that this area can have as much support and resources as possible. And we know that every time I'm at the engagement center, every time I am engaging with residents in the area, I meet folks who are coming in from all across the state and the region. The city has created nearly 200 low-threshold supportive housing units that did not exist a year ago. These units have been critical in ensuring that we could serve so many residents, and the outcomes have been truly phenomenal in terms of the uptake on treatment and services that specific individuals who are in these housing units have been able to access. This model for these individuals who are able to access this housing works, but we need more support. And in the city, as we continue to permit and add more units within Boston, we are calling on the state to step up as a partner. We need the state to help create 1,000 new low-threshold units outside the city of Boston. This is the scale of support that would allow us to truly address this regional crisis. Okay, we are going to cut this and go off to the side. So thank you, everyone, for being here. I appreciate you letting us share this information.